Hello, my name is Mike Kozelski. I'm a P3 pharmacy student. Today I'm going to be going over blood glucose testing and the OneTouch Ultra 2 glucose monitor. So I have Rufa, who's going to be assisting me as well. She's going to be my pin cushion. So the first thing we're going to do is we're going to go over the equipment that's going to be needed for this, and then we're going to go over the actual testing method. So first thing, most patients carry around a small case like this, and it's going to include everything that you need. So just real quickly, we have our Lancet with cap, we have our Band-Aid, we have our alcohol prep, our lancing device, our glucose test strips, and then our actual monitor, OneTouch Ultra 2. Some patients do carry an extra set of batteries. It is recommended because if they, obviously the meter can't run if the batteries are dead. So the next thing we're going to do is that you would have proper hand sanitation. You'd either wash your hands or use alcohol sanitizer, and then you would use gloves because you are having blood exposure. Alright, so now that we've properly cleaned our hands and sanitized them, I put on blue nitrile gloves. So you can use vinyl gloves too if that's all that you have available. Right, so we're just going to now go over the lancing device and how you're going to load it with the Lancet to essentially get the blood from the patient's finger. So this is the lancing device. Here, this is the cocking mechanism, which will, as you can see, the button pops up and you would press it, and therefore the lancing needle would come out. Now the settings here are for how deep you want to go into the patient's finger. So if the patient has calluses or has poor circulation in their fingers, sometimes you have to go a little deeper. If that was the case, then you'd want to dial it to 9 or 8 or 7. The higher the number, the deeper it goes in the patient's finger. Now if the patient has a bleeding risk and you don't want to go that far, you might want to dial it down to a 1 or a 2 or a 3. I find that most patients doing blood glucose testing will use about a 4. So that's where we're going to start today. Alright, so you're going to then take off the cap, and as you can see there's the inside of the lancing device. You're going to take your Lancet, like so. Most of them look very similar to this. And you're going to place the Lancet as far down as it will go. Now, you're going to very carefully twist off the cap of it and expose the needle on the Lancet. Now, next thing you're going to do is replace the outer cap on top here, and now it's ready to go. Alright, so before we try to get blood out of the patient's finger, we're going to set up the blood glucose monitoring device. Alright, so this is a OneTouch Ultra 2. Alright, as you can see, you would hold down the OK button and you would turn it on. Now these are great devices. They're very advanced now. They'll catalog your results for, I believe, up to a year. So you can see there's last result, all result, result average, so on and so forth. You can also do comments on your blood glucose testing, and if it's high, you can say well, I ate too much, or didn't eat enough, or I was exercising, and you can kind of give an explanation so you can remind yourself, or the patient can remind themselves or their self, what was going on in that specific testing. Alright, in this case we're going to turn it off though. Alright, so now the monitor's gone off. You can also go to meter off, which is at the bottom of the screen there. Alright, so what you're going to do when you're actually doing testing is you're going to open your testing vial of your test strips and remove one test strip out. Now there's two parts to every test strip. On the left side, on the right side of your screen, is going to be the actual barcode over here. Alright, that's going to go inside of the testing device at the top. On this side, we have the blood collecting device, which is going to be touched to the patient's finger. So now we'll take this, take the barcode and slide it into the blood glucose testing meter. As you can see, it comes back on and it asks you for the code on the test strips. Now in this case, this meter is already set up for our code. The code is usually on the vial of test strips. You can see that's code 25, it matches. Now it's asking you to apply blood to the test strip. Alright, so we're going to set that down now that that's all set up, and we're going to prepare the patient. So I'm going to take an alcohol prep pad. Get your middle finger, please. Just give me your middle finger. Thank you. Now we usually like to test on the side of a patient's finger because doing it on the front here, because they're grabbing stuff, it's a little more painful. Alright, so we're going to wipe it down. Now you always want to have a sharps container nearby or somewhere to properly dispose of the lancets, the alcohol pads, so on and so forth. That way you don't do any contamination with the blood. Alright, so we're just waiting for the alcohol to dry off of the patient's finger, because if you don't let the alcohol dry, then you might get a false reading. Alright, so now we have the lancing device, and like I said, it's going to be set to a 4. Alright, and we're going to poke the patient's finger. Okay, so now we have the patient's finger prepped. We have our lancing device ready. So we're going to press it against the patient's finger, and they're going to feel a little poke. Alright. Alright, so you're going to gently squeeze the patient's finger. You can also try to coax blood up as well. Alright, so that's the first drop of blood. Now we don't want to take the first drop of blood because sometimes there's alcohol on there and stuff. So we're just going to clean that off. And we're going to take the second drop of blood. Now we have the second drop of blood. So we're going to again take our barcode, slide it in there. Meter's going to turn on. It says to check the code. We already checked the code, so we're all set. And now we're just going to touch it real quick, and it's going to draw it up. Alright. And it says 95 milligrams per deciliter. Alright, so now the reading is done. So we'll set down the meter. Grab a Band-Aid for the patient.